Yes, at Parr PT, we treat a lot of TMJ or jaw pain. There's a lot of different things that you can do aside from just doing outside fascial releases on the jaw, but we can do some internal work. There's a lot of soft tissue on the inside of the jaw that affects the way that TMJ or that joint is moving. Depending on your tolerance, we have other versions that we can use dry needling. We can use microcurrent point stimulation. So the whole idea, since that muscle, there's a lot of nerves that kind of go through and out onto the face. We want to make sure that we're as sensitive as we can. So between those 4 or 5 different options, in addition to the work that we do on the neck, and again, the rest of the body, that's how we go about treating TMJ or other jaw-related issues. The type of shoes that you'll benefit from obviously are going to vary. It depends on whether you're more flat-footed or you have your arches that are too high. Maybe you've had surgeries on the foot. So as far as having a specific brand of shoe, it's really hard. I personally don't have any relationships with any shoe companies, but the shoes that I like are Allbirds. They just have a really good padding, good support in different areas. I also like the New Balance Zante Foams, version 4s. But again, they're 2 different kinds of shoes, but they vary in support. And what I would really recommend anyone else is see someone who specializes in custom shoe fitting or custom orthotics or something along those lines that they can actually tailor it to you, because if you're just going based on a brand, it may not be exactly what you're looking for depending on what you've had before. Things to expect after our treatments are typically either feeling tired or feeling like you're having a flare-up. And the flare-up meaning, if you've gone to the gym after a long time and then the next day you're feeling super sore, you feel like a truck hit you. It's a very similar feeling. It's not so much that your body is that sore. It's just because we're working with the autonomic nervous system and you're in this adrenaline phase the entire time, the minute we relax it and then also target areas that haven't been addressed before, the minute that those muscles are released, of course, you're getting more circulation back and you're going to feel more of that soreness or that flare up because your body's trying to get used to, 1, the new posture, and then 2, it's having to flush out all the stuff that was there before that shouldn't have been in there to begin with. But it only lasts between 18 to 36 hours. So usually that's after the first one. After that, the flare up, so to speak, tend to reduce over time, and to the point that you're not really getting much after these treatments. Well, when you work with the autonomic nervous system, most people tend to be in that sympathetic response or that fight or flight response. So because that adrenaline or that the system is so high, the minute we calm it down, the body rests, but then it feels that crash of calming because it's been in such a high sympathetic state the entire time. After treatments, we calm it down, you feel good, and then you just feel completely exhausted because your body's been overworking for so long that now that it's been addressed, your body has to adapt to this new stimulus. All patients who come in must have a referral from a doctor with a diagnosis. Now, if patients are looking for other diagnoses related to symptoms that they're having, we do provide certain testing that will allow us to check certain biomechanical impairments, certain positions, certain scores like Baton scales where we're looking for hypermobility. But as far as the testing goes, we're looking at how we're treating from a physical therapy standpoint. PTs cannot actually diagnose anyone. So refer back to your orthopedic or your PCP, but in general, we're able to do the testing that can get you started until you can find the proper diagnosis. All programs are sent via email, so it's in a PDF format, telling you what days to do it, how many repetitions, the structure of the order, basically everything that you need. There are occasions where when it's sent over, it might actually go to your spam. So in most cases, check your email, and if it's not in your email, check your spam. If there's an issue, then we'd be happy to resend it.